Good morning. We're so sorry we can't join you in person today for this kickoff session. We're very excited to be a participant in the Healthcare Leadership Academy. My name is Kevin Schulman, and together with Will Mitchell, we'll be your Duke University representatives working with you to address the issue of leadership with a strategic purpose. Will and I actually bring a whole wealth of experience. For a dozen years, I ran the healthcare programs at the business school here at Duke, and Will served as the head of strategy for that area. Together, we've been working with physicians to try and understand critical aspects of business and how they apply to improving the quality and efficiency of healthcare. This module and this work that you're all doing today is really critically important. All of us are facing challenges of how to organize care delivery better, how to be accountable for the services that we provide, how to understand and engage with our patients in a way that improves their care and their outcomes, and more importantly, how do we work together in teams, in a hospital organization and a clinical unit where more and more of us are interacting not as solo physicians, but leaders of a care team or administrative team that really has a different set of challenges than we learned about in medical school. So what is leadership with a strategic purpose? First off, we have to look at strategy. What is strategy? What are we trying to accomplish with our organization? Are we trying to be the best primary care hospital in our region? Are we trying to become a regional referral center? Are we trying to become a training center? Do we want to be a resource to our community? Do we want to be the highest quality clinical care? All of these are options and choices, and beneath all of this, once we decide what our mission is, how do we accomplish that goal? How do we understand where we're at today, and how do we understand what changes we need to make, what investments we need to make, what skills we need to acquire to help us to accomplish our goal? Now that we've articulated our strategy, our next challenge is to bring the organization around to addressing whatever our goals are moving forward. As we think about our organizational strategy, really have to be able to communicate effectively with the people around us, to get them engaged, to share knowledge between people who have business skills and people who have clinical skills, all around our joint effort at accomplishing our organizational goals. This is the concept of leadership. How do we work in multidisciplinary teams? How do we communicate better across people with very, very different backgrounds? And how do we use those folks with different kinds of training than we have as a resource? So the leadership module, our second module, will really focus on that issue. Leadership is a whole set of skills around us as individuals, as clinicians, being looked up to by other people around the room. So how do we communicate with people, maybe people that don't have the same background that we do, don't have the same clinical background? How do we learn from people that have other skills? While we spent all that time in medical school, our business colleagues spent a long time in the business side of learning how to do financial analysis, accounting. So how do we learn from them and make them feel like a valuable part of our team? How do we rise to unique challenges? In our day-to-day environment, we could plan on getting here in the morning and have a routine day and find out in the middle of the day something critical has come up. How do we organize resources to address it? How do we think through problems before we respond and react? And how do we organize ourselves so that, in fact, the day-to-day processes can continue to occur even in the face of challenges like this? Finally, we need to bring all this back together. Our last module will look at the issue of data and managing an environment where we use data to help us understand our current performance and to help us achieve our future goals. Data are really a critical tool for managers to understand and assess situations, plans, and progress. So how do we set up a data infrastructure that's appropriate for our organization? What metrics are going to help us understand whether or not we're moving in the right direction or achieving our goals? And how do we think about rewarding people in our organization based on the metrics that we've established? You know, they say if you don't measure it, you can't manage it. And metrics really are critically important. So again, this is just a little bit of a taste of a flavor of our session on leadership with a strategic purpose. Again, we're very sorry we can't join you in person today for the kickoff, but we're very much looking forward to joining you all in person as we explore a Healthcare Leadership Academy and our module. Thank you so much.